you doing? Okay, not so great. Well, I hope that we can get that all fixed for you today. Alright? So, welcome to the Headache Relief Clinic. My name is Calliope, and I'm going to be your technician today. So I'm just going to sanitize my hands real quick. I've got most of your information already here, but I would like to go through a questionnaire regarding your symptoms, okay? All right. So before we get on with that, is there anything at all that I can change in this room to make your symptoms feel a little better? I've kept the lights a little low, and most bright colors, save for my hair, are blocked out so that you don't have anything distracting that might make you feel a little worse, okay? Alright. Is the temperature of the room okay? Is all that good? Alright, you just let me know if at any point you need that changed, okay? So I have our questionnaire here. In the interest of keeping your headache from getting any worse, I'm going to be using just the paper questionnaire in addition to a little pencil here. We want to make sure that we are using softer sounds so that we're not triggering any other symptoms or making them worse. Okay? Alright, so right now, you said you had a headache currently. Are there any other symptoms that are going along with that? Any nausea, sensitivity to light, anything of that sort? Fatigue? Alright, very good. And on a scale from 1 to 10, with 1 being the least pain and 10 being the most pain you've ever experienced, how would you rate your symptoms right now? Okay. Alright, and how often do you tend to get these headaches or even migraines? Okay. And how long has this been going on? Is this days, months, years? No, not this particular headache, but in general, how often have you gotten these kinds of headaches? Okay. All right. And where exactly is the pain located on your head? Is it like an ice pick headache that you get right in the corners of your eyes? Do you feel it in your forehead, your sinuses, your temples, around your ears? Where exactly is that pain? Okay. Okay, and how would you describe the quality of the pain? What I mean is it dull, sharp, throbbing, aching? Any of those ring a bell to you? Okay. All right, is it always in the same location with the same kind of quality? Are there any other locations or any other qualities that these headaches come on? Okay. All right. And have you tried any sort of treatment at all, whether it's going to a doctor, getting over-the-counter medication, prescriptions, any sort of home remedies? Anything like that? Okay. And did anything help at all? Okay, so pressure tends to help a little bit, right? If you're careful about it, sure. And, okay, so dark room or blocking out bright lights. Okay, that's good. Have you had any sort of head injury or trauma at all in your entire life, not just in the recent events of your life? Okay. Have you had any sort of neck pain at all? Okay. Do you have any issues with your temporomandibular joint at all? Do you find that gets quite sore? Okay. Do you grind your teeth at night or in general? Okay. Do you have diabetes? Do you wear glasses or contacts at all? Even using like reading glasses or just glasses for driving? Okay. Very good. And any other acute or chronic conditions at all? Okay. And do you take any medications? I've got a little list here, but I just want to confirm that with you. Okay. Very good. And how have your stress levels been lately? Okay. And do you foresee that stress being lessened anytime soon, whether by your own influence or outside influences? Okay. I suppose maybe I should word that as, is it situational, right? Okay. All right. So that's going to conclude our questionnaire. I know it was quite a lot of questions to get through. You'll give me just a moment. There we go. Okay. So we're going to be conducting a little examination to make sure that there isn't anything obvious going on that we can treat right away, or if there's something we need to dig a little deeper about, okay? So for this exam, I'm not going to be using any gloves, if that's okay with you, okay? I know the sound can be a little harsh for some people, especially when one is experiencing a headache, so I want you to be aware of that. If it makes you uncomfortable, I can certainly pop them on. Okay, all right. So for this examination, I am going to need to be touching you. Is that okay with you? Do I have your permission to do that? Okay, wonderful. So I'm going to start first with palpating along your head, okay? I'll palpate the place where you said your headache is. I'll be looking all around to just determine if there's any lumps or bumps that shouldn't be there, and make sure that certain lumps and bumps that are supposed to be there are, okay? Alright, so I'm just going to be feeling around. I want you to please let me know if there's any pain or any discomfort, okay? So I'm going to start just around the forehead and the hairline here. It's a lot of very careful palpation. I use a firm enough hand to make sure that I'm ascertaining the information that I need, but light enough that it shouldn't disturb your head. How are you doing so far? Okay, just want to make sure. So nothing is uncomfortable so far, right? Nothing is exacerbating a headache of yours. Okay, that's good. That's good. Just being very gingerly about it. So where your headache is here, if I press on this, is that tender? Okay. Does that relieve some of the pain or help that at all if I press down a bit? Okay, it does. All right, that's good. Definitely have to keep that in mind for when we work on our treatment. Okay, I'm just going to note that down. Okay, so now I'm just going to feel around your face, okay? So let me know again, any pain, any discomfort. Do you tend to have these headaches at a certain time of the year? Do you think perhaps they're affected by seasonal allergies or changes in the weather, maybe? Some people are quite sensitive to that. For example, I myself am dealing with a little bit of general unease because apparently the barometric pressure is a little wonky, as my mama would say. Also, the farmers are still working in the field, so it's very dusty. It's very dusty, low humidity. Once the snow puts a blanket on everything, hopefully the allergies won't be so bad, save for dust and whatnot inside the house. But some people are quite sensitive to that. Okay, so are there any areas that I've been pressing on that you felt any sort of discomfort? No? Okay. So I'm going to check your sinuses now. So I'm going to be going along the maxillary sinuses. I'll go along the sinus cavities in your nose and the frontal sinuses, okay? All right, so I'm going to be pressing. I might do a little tapping. Let me know if it's painful at all, okay? All right, so I'm just going to be pressing. Okay, any pain there? And what if I just do a little bit of tapping along here? How is that? Okay. All right, I'm going to come in along your nose. I'm just going to be pressing. Okay, how was that? All good? Okay, I'm just going to do a little tap, 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 tap on your nose. How is this? Okay, that's all right. And I'm going to finally do that on your forehead. I'm just going to press, and press. Okay, anything there? Very good. Now we're going to do a little tapping. Sinus headaches are some of the worst headaches, in my opinion. Especially because it's almost like even when you try to treat it, it still lingers quite a bit, doesn't it? Alright. Okay, so now we're going to check a couple other pretty frequent offenders, okay? I'm going to be feeling around your TMJ here, your temporomandibular joint, as well as your temporalis muscle, okay? Right. So do you have any trouble with opening or closing your mouth? Any pain, any tenderness in that? Okay, so a touch of soreness. All right. So I'm just going to feel along that joint. Any pain here? Okay, and if you could just open your mouth for me. Good. And close. Open. Close. Okay. Any pain or discomfort in that? Okay. All right. So we're going to do that again, but I'm going to do it up around your temporalis muscle here. Okay. Any pain while I'm palpating around here? Okay. And if you could open your mouth. Close, open, close. Very good. Any pain or discomfort in that? Okay, so with that little bit of soreness in the TMJ area there, it's very possible that you are clenching your teeth and aren't aware of it, or you're grinding your teeth. It's actually quite a frequent thing that people do. So something that you could try is if you would like to just click your tongue on the roof of your mouth a couple times. It sounds kind of funny, but if you just do a little like that, okay? And wherever your tongue rested on the roof of your mouth, when you click your mouth like that, I want you to press your tongue there, okay? So that keeps your mouth slightly open, your jaw a little relaxed, and it keeps your teeth from resting on each other, okay? So that little, how do you call it, a maneuver, that positioning forms a little bit of a vacuum so that your tongue doesn't get tired or fatigued while you are using it to separate your teeth. Okay, so sometimes you can just do that throughout the day. Just click your tongue, and wherever your tongue rests, that's where you want to put your tongue, and it allows your teeth to just be slightly separated. So that helps take the pressure off your teeth, off your jaw, okay? It depends on what language you speak, like your mother language. Some people, your tongue naturally rests on the bottom of your mouth. Like, for example, I believe Russian speakers naturally oftentimes have their tongue resting on the bottom of their mouth. And oftentimes English speakers have their tongue resting on the top of their mouth. So it's a little bit of a funny thing to get used to, but it may help. It's always worth a shot. Okay? So now we're going to do a little lymph node examination. I just want to check if anything is distended, if there's any sort of fluid buildup. So that could indicate that we're dealing with perhaps an infection or you're fighting off something. Okay, so I'm going to start with the occipital nodes in the back of your head. Okay, let me know again if there's any pain or any discomfort. Post-auricular nodes. carotid, and the submental and submandibular under the jaw. Okay, and all the different cervical nodes in the neck. And down to the supraclavicular, which are right along the clavicle. Okay, so no pain or discomfort there. Okay, I didn't feel any sort of distension in the node, so that's good. So I'm going to feel around your neck a little bit. I'm not going to do too much pressure that it's uncomfortable, but please let me know if anything is uncomfortable. Okay, so I just want to feel for any painful or tender spots along the neck. Okay, and even up into the occiput here. Any pain or tenderness here? Okay, very good. And if I come to the base of the neck here, how is that? Okay. So, any pain or tenderness in any of this? Okay, that's good. Do you believe that you have fairly good posture, or do you crane your neck quite a bit? Okay, so that's possibly a contributor to your headaches as well. I mean, the spine is a huge interconnected column that if something's goofy with that, you can feel it in the most random of places. If you have something happening with your lower back, you can feel it in your feet. If you have something happening with the vertebra in your neck, then you can feel it in your head. So that's something that we can also look to in the future as well, okay? All right, so let's see. Okay, so finally I want to do a little examination with your eyes, okay? I am going to be using a pen light. With the slight sensitivity to light, it may produce a little bit of discomfort. I want you to let me know if it does, okay? I'll try to be quick. So I just want to have a little look at your eyes. So I'll be getting a little close here, okay? Just a little close. Alright. So I can see just a little bit of redness around the eyes. How's your sleep quality been lately? Okay, definitely a contributor if we're getting poor sleep, or maybe we're getting a lot of hours of sleep but it's not very deep sleep, okay? So that could definitely be part of it, I think. Okay, so we're gonna do that little light examination. So all I need you to do is look straight forward. You could look at my nose if you'd like, okay? And I'm just going to be bringing my pen light in towards your eyes, okay? Right. Okay. Let me know if there's any pain or discomfort with this, okay? All right. There we go, okay. All right. Very good. All right, that looks good. So real quick, okay, so it shouldn't affect you too bad. So I'm just going to finish my notes real quick. So for our treatment options today, we like to try a few different techniques, okay? So we have some different temperature options that we can try. We also can employ the use of different pressures and massage, but regardless of what we're doing, we're going to be blocking out the light for you. So I'll just be grabbing a little towel for your eyes, and we're just going to lightly put that on your eyes. So that hopefully will help ease some of those symptoms, right? So for the future, things that we can maybe try that perhaps you haven't, perhaps you have. You may think about using anti-inflammatories like ibuprofen or naproxen. You can also think about aspirin or acetaminophen. Another thing that maybe you've tried, maybe you haven't, is you could try CBD. So when used in smaller quantities, it feels almost as if you've taken pain medicine before and you just notice that sometime down the line your pain isn't as bad and you didn't realize the moment that it happened, but it did. That's kind of like how CBD is, okay? When you use it in small amounts, you don't even realize that your pain or your symptoms are not as bad. You just all of a sudden notice that, okay, so that's eased up a bit. So that's another option to try. So if we need to go a little deeper into that, there are certainly prescription medications that we can try. If it's a migraine, there are tons of options for things that stop a migraine. There are new types of medications that have come out recently that are sort of the holy grail of headache medications, okay? So we can certainly try some of those in the future if you still have this problem, okay? Okay. So we're gonna go ahead and block out the light for you. So I have a little towel here that I'm just going to be placing over your eyes, okay? So we're gonna block out the light. I'll let you know what I'm doing the entire time so that you don't have, any anxiety or trepidation about what's going on, okay? So I'm just going to place this over your eyes, okay? There we go. Alright, so with all the light blocked out, we're gonna try a few different things here. One thing I wanted to ask you about is if you have any sensitivity to smell, if that makes your symptoms worse at all. Okay, I ask because I actually have a little bit of essential oil that I can open up for you. So this is eucalyptus oil, alright? And eucalyptus oil is excellent for sinus issues or any sort of congestion. It can help with headaches. It's also excellent for nausea. So I wanted to see if this worked for you. I've just got this little bottle and I'm just going to hold it up to your nose, not too close. Just like this, okay? You want to take a little smell. Okay, how is that for you? Okay, if you think it would be something that could help, then I can pop a few drops in my hands. That way it'll just very softly diffuse through the room during the treatment, but that's up to you, okay? Alright, let me go ahead and just put a drop here, a drop here. Okay, just going to disperse that through my hands. Okay, very good. So the first thing that I want to do is I want to try our temperature treatments, because if either one of those works well for you, then we can continue that temperature choice throughout the treatment. So first, I'm just going to grab one of our cold towels. I'm just going to roll this up. Okay, and I'm going to just place this on different parts of your head and your neck, and you let me know if the pain gets worse or if it feels better, okay? So, here on your forehead. Okay, what about on your temple? Okay, and how about the top of your head? And the back of your head? Okay, and what about underneath your neck here? How is that? Okay. Yeah, a cold towel certainly can be excellent for, it tends to be for migraines mostly, or if one is experiencing nausea, but we can see if the warm towel does better. I'm just going to get that one out. Okay, we'll get that one all rolled up. Very good. Okay, so just like before, we'll go to the forehead. All right, and the temple. Okay, and the top of the head here. And right here on the head, more towards the back. Okay, and the back of the neck here. How is that? Okay, so out of all those different positions, all those temperature options, was there something that worked best for you? Alright, so I'm just going to place that towel in that area for you, okay? Right? There we go. So let's go ahead and work on a little bit of pressure and a little bit of massage, okay? Alright, so I'm just going to be pressing along in different parts around your head, doing a little bit of massage, okay? So I'm actually going to stand up for this. And that way I can have full access to your head, okay? Alright, so I'm just going to be pressing my hands along your skull here. You let me know if anything makes it worse, okay? I certainly don't want to exacerbate your pain at all, okay? So just little bits of pressure here. And if there's any part that you feel might benefit from some deeper pressure, you just let me know, okay? We can certainly do that. Alright, there we go. So, do your best to just relax. I know it can be a little difficult when you're in pain. You can follow my voice a bit, or you can do your best to take some deep breaths, okay? get some rich oxygen in those lungs. All right. Is there any place where the pressure has been the best so far? Okay. So let me work in a little bit of massage here, okay? So it's going to be a little light at first. You let me know if this pressure is not enough for you, or if it's too much, or if a better area would be more benefited, okay? Very soft. There. Just moving my little chair out of the way a bit. Okay. Very good. I hope you're able to put all those little outdoor noises out of your mind. Unfortunately, it's just a byproduct of living along the railroad, huh? Yeah. Alright. I'm going to go in with a little bit of a firmer pressure, okay? Alright, so this spot right here, this is where it mostly is at. Okay, and if I just massage little circles in here, does that feel better? Okay, very good. Very good, okay. And what about a little bit of a deeper pressure here? Okay, so that helps some too. That's good. Very good. You can just keep up that pressure and a little bit of massage in here. How are your symptoms currently from that headache and any surrounding symptoms? How are you doing? Alright, so it's helping a bit. That's good. That's good. We certainly like to hear that. Is there anything I can do for you right now that would make it better? Okay. I'm just going to keep this up. And I'm going to keep the talking to a minimum. And I hope this helps you relax. little bit more. Okay, so I'm just going to sit back down. Very good. So, how are you feeling? Okay, that's great. So I'm going to take the towel off of your eyes and we're going to conclude our session, okay? Alright. Hello. Welcome back. You don't have to open your eyes if you don't wish. You can keep them closed, okay? So that's going to conclude our headache relief treatment, alright? So you're more than welcome to use this room to take a little nap or rest, okay? So I hope that your symptoms are at least alleviated or that they abate pretty soon, okay? Is there anything else I can do for you? Alright, you just let me know, okay? Thank you so much for coming to the clinic to have this headache relief treatment. I hope that it was